course, like I said, today we're taking your questions and we want to delve a bit deeper into this new strain and our COVID protocols, anything COVID-19. So we'll have a bit of an extensive conversation. I have here in the studio with me Dr. Samuel Kojo Amoakohene. He's an anesthesiologist. How did I get that wrong? Anesthesiologist, a COVID-19 ICU team leader at ECHN Health Network in Connecticut. He's a co-founder and president of Global Partnerships Halodyne LLC. Doc, you're welcome to the show and thank you very much for your time.
Thanks for having me, Gifty.
Okay, so we've been seeing you talk a lot about COVID on Newsfile. Right. Today we have you here. We want to get interactive and ask our viewers to get in touch with us with their questions and their thoughts on their mind. I just want to, you've been in Ghana since when?
I've been in Ghana since the 10th of this month.
Oh, this month.
Yeah.
So walk me through the experience, from the airport all the way into the country, comparing to what you have back there in the U.S., which is, of course, one of the countries hardest hit by COVID-19.
I think coming in for the first time since the COVID outbreak, I really wasn't sure what to expect. Okay. Obviously, in the U.S. right now, most places people don't wear the mask, except when you go into stores. So I was kind of like looking forward to what their preaching has been, specifically to Ghana and what we're doing. At the airports, you really observe people, most of the people wearing masks. Mm-hmm. Social distancing is another thing to talk about. But generally, people were trying to observe the protocols by trying to wear the mask and sanitizing, and you saw the hand sanitizers everywhere. So those were very encouraging. And then obviously, once you transition from the airport into the city, it's a different ballgame.
It's a different ballgame, isn't it?
Yeah.
Okay, so let's look at the new strain. Mm-hmm. You talk about, and I wanted you to take us through what you saw at the airport so we can try to have a context to the conversation of how this new strain got in. Maybe we won't be able to have all the answers now. We've seen the health ministry, issue a statement today in which they say, yes, there has been, I think, about 6 confirmed at the airport, but it's not gone to the community yet. I'll take your thought on that. But if we were to assess what is happening in India and imagine that we have a strain of that here in Ghana, what will be your thought from a public health perspective? Immediately, what comes to mind? And to what extent is Ghana exposed to what risk?
Well, that's a great question, a loaded question.
It is indeed
I think when you have to sort of step away from everything else that's happening. And for Ghana specifically, our first defense is at the airports. And I think it's a great thing that the country is able to do aggressive testing, very sensitive antigen testing, which is going to pick up about 90% of the positive cases that you have.
Okay.
Obviously, that's not 100%.
Yeah.
And so whatever positives you pick up, one can safely assume that there may be 1 or 2 or few cases that you may not be able to pick up. If I just say I'm on a flight, I got tested, and at the airport I get tested again. But on the flight, I picked up a viral particles, right? You may not be able to see it because my body I'm not fully infected yet. So I'll be allowed to go home.
Yeah.
And then obviously once I get into the community, albeit that I've been told I'm negative, now I'm going to be able to pass it on. So it's good that we're doing aggressive testing at the airports, but it's also important to recognize that the moment you begin to see them or pick them up at the airports, you have to then step up your preparation, genomic sequencing and aggressive testing, even within the community. Because you more than likely have some of that Delta strain within your community. You just don't know it yet.
You just don't know it yet.
Just don't know it yet.
Because you say that the protocols you find at the airport are encouraging, but 90% could be detected. So that 10% is still most likely in the community. You may have that. I mean, we dealt with the same situation in the U.S. at the beginning of the pandemic when we would assume that the virus is coming from Europe, and we're like, oh, we're picking them up at the airport, setting them off those strains were in the community. And then sooner or later, we found out that we actually had more.
We just were not aggressive for that testing.
Okay.
And so if there's anything that the pandemic has taught us is that you always have to be at the forefront. You have to be really proactive in being able to detect what kind of particular strain you may have within your border. So those are some of the things to really sort of hone in on and really be aggressive. But assuming that you've only picked a couple cases up and it's totally isolated to the people coming into the country, I think looking beyond that is the key, being really proactive.
Talking about looking beyond that, what should, from your perspective, we be looking at as a country, immediate, short, long term? You've talked about aggressive testing. Should this be aggressive testing that is focused on the community, or should we just now make the protocols at the airport even more stricter, or both?
I think you have to, like you say, you have to take it up into what are you doing right now? Right now, the best thing you can do is really keep up with what you're doing at the airports, but also in the communities, be willing to continue with your genomic sequencing to really know, as you are testing people and you're sort of able to isolate randomly, find out how many of these positive cases you're having, especially when you take Kumasi, for example, in the Ashanti region, of these cases that are turning positive, how many of them are you detecting to be the Delta variant, which we will talk about, right? So those are some of the immediate things at the airport. In the short term, those are some of the things you want to sort of look at. The third term goal will be to really make sure that when you do get hit with a third wave, whether it's a large scale or medium scale or small scale, do you have the ancillary support to be able to treat these patients? I'll give you an example. In Russia, where they have the Sputnik V vaccine, they've had their ICUs flooded with patients with the Delta variant. And it is reported that these doctors are trying the best they could to treat patients, except that the treatment that we've used with the first and second wave isn't working. So if you're Ghana, you have to ask yourself, if people are failing out there with a lot more resources, what do I need to get in place? You're making sure you have your healthcare personnel, like your ventilator, your ICU capacity, and really being able to pick up people as soon as you can. So you don't let people come to you, you want to pick them early enough so that they don't deteriorate so quickly, because COVID patients can go very quickly.
And COVID patients could go very quickly, but we're also seeing that the strain in India is very, very different. Yesterday we spoke to the head of Noguchi, who said that antigen testing is very good, that we ought to step up with our antigen testing, you know, and you have mentioned aggressive testing. I don't know the extent to which wearing the mask and observing the protocols actually step in when we're dealing with what happened in, you know, the Indian strain. I don't know the extent to which it's effective, but the head of the Noguchi said it looks like in the immediate term that is the best solution. But do you get the sense that people actually understand, or how else can government make people, or health authorities make people get the message? I mean, I don't know how it was done in the US. Maybe you can run us through that, the way it was done there. But do you get the sense that people actually understand, or are the authorities really communicating what, from a public health perspective, they should?
I think when you take the US, for example, when COVID hit, it was clear that there was a problem on our hands. And so the news media never really gave up. And that sort of tension was always there. People knew what was happening, whether you wear the mask or you don't. It was being honed in every day. Certain measures from the government level was basically put in place to sort of incentivize people in really sticking to the protocol and try to engage in behaviors that were not going to put the whole country at large in a deep trouble. Now, those were the things we did. You still could not force people to wear the mask. You still couldn't force people to observe the protocol. I mean, that's a challenge that any nation, in all honesty, is going to face. And that's the reality of the situation. But I think what we in Ghana can do really is to ensure that we are adhering to the protocols. And how does that happen? When you have a situation in the Ashanti region, for example, where people think that the media or the government or we as in the healthcare community are not really speaking enough about the infection that is happening, the third wave that we are really concerned about. If that's not being talked about really well, then you're going to have the people thinking, oh, coronavirus came and it went. Everything is fine. So that message we have to be at the forefront. We need to really continue to tell people that this is a real disease and that with the third wave literally right here with us, we need to be very careful in how we go about and in how we observe the protocols. Those are some of the things that we can do. As far as ensuring that what do we do when we really get large number of it in our communities, I think it really comes down to our preparation, making sure that we can take people in, isolate them as quickly as we can, diagnose them, and treat them.
Okay, so I want you to send in your questions. If you have any questions on your mind, do send it to us on 0540109009. That's 0540109009. Let's hear from you. What are your thoughts? We'll still be expanding this conversation. Doc, I want us to talk about the vaccines. There have been concerns that AstraZeneca and Sputnik V are not as effective against this Indian strain. This morning, the notice or the statement we got from the health service says AstraZeneca is effective. I'm sure you've heard about this as well. What's your take?
So there's a lot in the media right now, right? When we started with the vaccines, we in the scientific community always talk about clinical trials. So when I sit at the table, I'm able to definitively say that a certain vaccine is 100% effective, 80% effective, 90% effective. Okay, take Moderna, Pfizer, AstraZeneca, Johnson & Johnson. These went through clinical trials. At this moment, we don't have any clinical trials to really say that definitively a certain type of vaccine is effective against the Delta strain. What we have is clinical judgment. So, for example, in the papers, in the news, in the scientific journals, there's been a lot of talk. In the UK, for example, there's a talk about the Public Health of England essentially did put out a notice basically saying that AstraZeneca appears to be effective, right? But you don't have
against which one? Against
the Delta variant.
The Delta variant.
Against the Delta variant, because they've been able to do sort of studies on these, but not clinical trials. So you're looking at the population in general. You're looking at how many of them are coming in with the new variant. How many of them are getting admitted with the new variant? How many of them are turning positive with the new variant? And you're asking yourself, of these patients getting sick, how many of them had the AstraZeneca vaccine? And you're deducing from that, right? So you see some positive news. It's not definitive. So I'll probably stay away from definitive, but I would say that there are promising signs that it may be effective. To what percentage is not, the jury is still out there.
I just want you to listen to head of the West Africa Center of Cell Biology and Infectious Pathogens at the University of Ghana, Professor Gordon Awandere. He has been speaking to my colleague Daniel Dazi. And Doc, I want you to listen to his concerns about this new strain. Listen.
Now we have to be looking at the right vaccines. We all this while we've been fixed on, AstraZeneca and Sputnik V. We have to start shifting towards looking for, more of Pfizer and others, which have a better chance of protecting against these variants. Because the future is these aggressive variants. That's where we are going. The UK strain would probably recede soon. It will be replaced by some of these new variants.
With the nature of the virus as we know it, there are new variants coming out every few months. So does that mean that we are going to have to vaccinate ourselves again when, there's another strain in the system that is different from what Johnson & Johnson and Pfizer can fight?
Yes, that's the reality, that this may be similar to the flu, that every year or every few years we have to adjust the vaccine to suit the prevailing strains. And so that's why local manufacturing and vaccine development is important. We need to start making serious progress
So that's Professor Wandari there. Those are his thoughts that he shared. What do you think?
I totally agree with him. We know that viruses mutate. That basically, simple terms, means they change their genetic makeup. And for example, when you take the Delta variant, one of the things that we've learned is that it's changing rapidly. It's very contagious. And it may be finding ways to evade the vaccines that we have. And so it's clear that this is where we're heading. What's important is that we need to really begin to think about how do we get ahead of it. It's not that you're going to be able to completely eliminate it, but you have to learn to live with it, which is, for example, if Ghana is able to join an alliance where we're able to locally produce or assemble vaccines and be able to use it on our people and also deliver or send out some outside within the sub-region, that will be a critical piece of us being a leader and also being really able to care for our people. And so I totally agree with him. I think it's the new way forward, and we cannot sit back. We have to continue to look elsewhere and how we can stay ahead of it.
So speaking of which, local production, the government has been talking a lot about this. Yesterday we heard that we're starting clinical trials and that they're already engaging some volunteers. I don't know if you're aware about this. Are you aware?
I'm not entirely aware of the clinical trials being started here in Ghana, picking up some volunteers. That I'm not aware. What I am aware of is the fact that government has already put out its intention to really try to basically set up a local manufacturing plant where we're going to be able to do this. Now I know that's in the early stages. As far as clinical trials in Ghana, that I'm not aware.
Okay, so let me take your thoughts. So you are well versed in this area as well. Should we be going through this process? And I've spoken to Professor Dodu, who is heads our standards authority, who is actually that's his area. Vaccines are his area, and he's indicated that Ghana has a reputation for sort of deflecting these proposals for clinical trials because people go out and say they're using us as guinea pigs, etc. If we were to actually be involved in vaccine production, what are the things you think we should have, the homework we should have done as a country to get it going smoothly and the way we expect of it?
So that really comes down to these vaccines have already been made, right? So for what Ghana is going to be doing is to basically get the patent, get the authorization, and teaming up, for example, Johnson & Johnson, which will allow Ghana to then be able to produce vaccines in Ghana and for the sub-region for that matter. It's not that we're entirely starting a new vaccine that now we have to go through clinical trials. When you live in the West, life is quite different. Some of us, my colleagues, we all volunteer to be part of the clinical trials because this is what we do. And yeah, there may be some side effects, but we also see the significance of partaking in such events. So I think from that perspective, it's a good thing that government is trying to do that. Now, if you were to talk about a situation where Ghana has found a way in the technology to develop a whole new vaccine, then the thing that we need to do as a people, or government needs to do, will be that we really educate our folks and let them know that what we're doing is really a higher standard to achieve, and we're setting a higher standard for us and for the sub-region for that matter, ensuring that people will be protected. For example, in the US, if you get enrolled in any kind of clinical trials, guess what, Gifty? You're forever protected. In terms of if you were to get sick, if there were any side effects, you are protected. Your medical bills, all of it is going to be protected. So that gives me the assurance and you the assurance that if I were to partake in such an event, I'm not risking my life for nothing. And if there's a good outcome, your name will be part of it. And that's something that we probably need to, as a nation, cultivate within us, that it's okay to sacrifice. That's something that people in the West do a lot. They will sacrifice for the greater good. And I think we can adopt some of that.
Okay, we'll see how it goes. Let's talk about a third wave expected in Ghana as we perhaps wrap up on this. But I've been getting a lot of questions about the vaccines, and I think we've answered a few. I think we've basically answered that question about the extent to which the vaccine can protect you. I think you've talked about it. I still see a few here. Let's see, before we go to preparations for a third wave, so to speak. Thomas is texting from Nalerugu. He says the World Bank and AU are collaborating to fund the affected African countries by subsidizing the vaccines. What is Ghana's take on that? I'm not quite sure what this answer, this question is. I don't know, Doc, if you are. I'm not quite sure. Does it make sense to you?
So I think probably what he's trying to get to is that the U.S. government, I think the past couple of days, put out a statement basically saying that they are now going to really release some vaccines for the global community, those in need, right? I think that's basically what he's getting at, which is a great thing for us, for people like countries like Ghana or developing countries, because as you know, India was producing majority of their AstraZeneca vaccines. Well, they got hit, so then they had to divert it. So COVAX, which most of these countries depend on, have not been able to deliver as everybody expected, right? So that's why, as a nation, we need to be more proactive and look for other alternatives in really ensuring that we're not just looking at one approach, so that if Gifty and I are not able to deliver, at least we can go to that person C to really help us out. But I think that's what he's alluding to.
And that actually brings me to the point, a conversation we've had in Ghana the past few weeks about procuring of vaccines, where Ghana was procuring vaccines through third parties because according to our authorities, we were unable to reach a government-to-government sort of engagement or government-to-government agreement between the Ghanaian and the Russian government. You must have heard about it. What's your take? I
think there's a lot of chatter about vaccine procurement and things like that, specifically the middleman usage. And I've said that I don't really like the term middleman usage because it creates a negative connotation. What we need
but what else it is? It's a middleman, because this person is not the producer of the vaccine.
It is. So here's how I put it.
Okay.
I don't like to use middlemen. I like to use the third parties who allow you to purchase these vaccines that you need for your people. When you take the United States and the UK and all these developed countries, they donated billions of dollars to be able to allow them to have a seat at the table. Then they set up agencies. Okay. So the US doesn't have to go through anyone, you or me. But any other country now has to find a way to get to Johnson & Johnson, AstraZeneca, Sputnik V vaccine, right? So the players that went in and donated and gave money, they now own these sort of vaccines and they have the power. Okay. So you just need to talk to the right team to be able to find you a seat at a table when you don't have the millions to be able to sort of make decisions. So it's a myth, the way I put it, in terms of the usage of middlemen and the effect that it's sort of playing in the media. I think third-party usage is a better term to use.
Okay. And so it sounds to me from the way you're describing this as something that's not so far-fetched, something that's pretty usual or typical in the way that things work.
Absolutely. I mean, I took the time to engaging with my colleagues in North America and in Europe. This is what they do. For example, Johnson & Johnson they don't go out selling vaccines through ordinary people. They have agents. Right? So you have to go through one of those agents to be able to procure what you need. And so it's a normal process. I think once it's transparent and it's clear and you tell the people what you're doing, where you're heading, the obstacles you've had and how you're overcoming them, I think you really put a lot of these things to rest. Okay,
well, transparency is one of the things that the people who discuss this matter called for. I'll just read a few of your messages and we'll move on. This one says, it's not only the people in the market. This person is actually texting from Kumasi. It's not only the people in the market, cars and other public gatherings who do not wear masks. Students in schools have equally not been wearing masks. Ibn Malik, you sent this message from Kumasi. Thank you very much. This one is asking, will there be the need for a person who has taken the double shot of AstraZeneca vaccine to take a third booster shot of, say, Pfizer to help prevent the new variant? Aguna Odobe, you don't add your name, but you're texting from Aguna Odobe. That's a very interesting question, isn't it?
That is a good one.
How do you respond to someone asking such a question?
So great question. I'm sure a lot of people have that. I think it really comes down to, you've heard of the term booster. You've heard of us talk about, those of us in the scientific community, talk about this may be an yearly event. So as of right now, we haven't gone there yet. We are definitely thinking about it, and I wouldn't be surprised if that becomes the norm. But for now, no.
Okay. Well, let me go. We're going to go to Nigeria right now. Experts have expressed worry at the threat of the Delta variant spreading and causing havoc in the West African sub-region. In Liberia, we understand that hospitals are full and the country is relying on Cote d'Ivoire for supply of oxygen. We are connecting with Betty Johnson Mbayo. She's a journalist from Liberia, so we can understand the situation there. Betty, sincere apologies for keeping you on for a while. What are you dealing with in Liberia?
So, let me say thank you. It is mine, and I am totally glad to be with you. And it is sad as a journalist to see citizens day by day, and they are being pronounced dead specifically after you've know them. And I can say that this reminds us about Ebola, because it is totally sad. We are dealing with it, and it's a reminder that we have not really learned from our Ebola crisis.
Let's get to a bit of specifics, if you have that information about how your health facilities are dealing with this. I mean, Liberia has been trying to build, the country back for some time now, and I assume that you've been doing very well with it. But now you talk about Ebola. Now we're talking about COVID-19. Now we're talking about the Indian strain. Do you have an idea how difficult it is for your health facilities to deal with it? As we understand, there is a shortage of oxygen.
Sure, yes. There's a shortage of oxygen. Of recent, the Indian representative to Liberia donated few oxygen, and it was meant to post, but then our health facilities are overstretched, and you find out that doctors and nurses are working beyond the stipulated time, and at the same time you find out that as a result, people are dying from usual illnesses because there are no beds within health facilities. So there has been a consistent outcry from citizens concerning medical facilities and denying them on grounds that there are no beds to accept those that have been ill. So
that
yes,
can be a very difficult,
our facilities are overstretched.
Yeah, that can be a very difficult situation to deal with. Betty, I just wanted to find out before we wrap up about restrictions. What sort of restrictions have been imposed in Liberia? I mean, there are a lot of Liberians who live here in Ghana. We know that Liberians travel around a lot as well. Have there been any restrictions imposed in the country?
Oh yes, of last week, the Ministry of Health and partners disclosed a new revised health measures, and at that they decided to stop people coming from India, from Bangladesh, and this as a result is not really the issue that we are complaining about.
Okay.
What we are complaining about is if you go at a COVID area and you decide to be tested, the delay of you having your test is an issue. Can you imagine that you will have signs or symptoms of being ill, and then you go at this testing facility that the government recognized, and when you go there, you are told that within 3 days, you're going to get your result. Our thing is not about those who are coming in. What we are saying is that there should be immediate test. At the same time, if your test is done, the results should be given to you. I mean, there's no need for someone to be tested and you allow them to go home. And after 3 days, before someone have the result. That's totally unfair.
Because in 3 days, it's also unfair because in 3 days, this person could have been spreading to several others who would be spreading, and then it goes on and on. Finally, Betty, are there vaccines? Has Liberia started vaccination?
And time, we also do not have a kind of postal service in Liberia.
Hello, Betty, can you hear me?
Say again?
Yes, I was asking about vaccinations.
Yes, yes.
Has the country started vaccination?
So yes, earlier of this year, we received 96,000 doses of the AstraZeneca vaccine, and our inquiry as journalists is that we were told that the vaccine should have been expired in April of this year, and the health authorities are mute on if the vaccine that have been administered, if it is expired or not. So yes, there are vaccination, but then the sincerity comes in. Citizens are asking why the president and his wife and other public officials are not taking the cues to go and take their vaccine. Because if they do take their vaccine, it's going to raise some hopes that this vaccine is of help if you have COVID.
So if I understand what you're saying, Betty, sorry to interrupt you. Sorry to interrupt you, Betty, but if I understand what you're saying clearly, the president or the state officials have not taken the jabs themselves, and so people are very reluctant, or people are hesitant to take the vaccine.
Majority of them, yes.
And there is an expiry date attached to the vaccine. That's what you're saying.
Yes.
Right.
Yes. Yes, that's the fact.
Betty, I thank you very much. I thank you very much for your patience and for your time explaining what the situation is in Liberia for us. That's Betty Johnson Mbayo. She's a journalist in Liberia. Doc, I'll take your thought quickly on Liberia, and then I want you to wrap up with us on how Ghana can prepare from your perspective towards a third wave, because we've been told to expect it.
Correct. Just listening to the journalists that you just spoke with, yeah, it makes you realize the difference between some of these countries. And as a nation, Ghana, I think we have to, I always say that we should always be positive and look at the glass as half full. And from that perspective, yes, there's a difference. Clearly, we're doing a lot more better compared to Liberia. I think specifically on what we can do, there's nothing that any country can do to stop it. It will happen. It's a matter of what level do you get it and what sort of preparation you put in place. And so the key is really being able to keep up there. You shouldn't have patients coming in, getting tested and going home for example, 3, 4, 5 days, assuming that before they get the results back. Antigen testing is great. Having the PCR before you board the flight is awesome. And then here, what we can do really is just continue the genomic sequencing, even within the community, ensuring that you have the capacity. If patients get sick and people get sick, you want to be able to isolate these patients in hospitals, in isolation centers, where you can truly try to decrease the sort of infectivity rate. Otherwise, it's going to be a problem, and you're going to have, unfortunately, a lot of lives lost. And so those are the things we should keep in mind.
Let me just read a few of your messages from our viewers. And Betty, I'm sure that you've heard what the doctor we have here in studio has said. Maybe the message can be spread, and I really sincerely hope that there will be some kind of help with the situation in Liberia. This one says, I want to make a humble submission, Gifty. Please, I guess the government must be strict with the adherence of the protocols. I guess it's about time the government revises the measures to keep us on our toes. Kofi Abochi sent this message from Ga East. This one says, our health authorities in Ghana, okay, says, is government still charging $150 for COVID-19 antigen rapid tests? They're taking $50 at the moment at the Kotoka International Airport. Samuel, health authorities in Ghana to be trusted. Samuel sent this message from Germany. Samuel, thank you very much for your message as well. And someone is asking about where you get your jobs. At the moment, I don't think there is any vaccination going on here in Ghana at the moment, so I'm not sure. Ama sent that message from Wager. Ama, thank you very much. And finally, this one says, so far, the providence of the Most High has kept Ghana and Africa from the predictions of doom over our continent. I believe we should continue doing our best. However, no matter the variant that emerges, the God of heaven will preserve us. Or Kojo send us from Kaswa. Doc, let's take your final message and then we go on. We wrap up.
I think my message to Ghanaians is very simple and clear. The reality is the simple fact that everyone is tired of having to wear masks and sticking to these protocols. But I always try to drive home the point that those of us in the healthcare sector who are basically witnessing these severities and illnesses due to COVID-19, I think we need to continue to preach the message. I was humbled by the number of deaths that I saw in the ICU. And that I always try to tell people, don't take this disease for granted. It can affect you. It's definitely affecting people. And yes, it is hard to wear masks in the middle of all the heat that we do get from time to time. And sometimes even if you need to take a mask break, do it. Take a mask break, but put it on. I think that is the one thing I can tell you. And be assured that government is doing whatever they can to really help. But we also need to do our part whilst we put the pressure on government to help us survive.
Right. Thank you very much. And just as we were about to go, I got this message that says, very informative. Doctor, thank you to the doctor. This is Anderson from Tichman. So, Doc, this listener has just thanked you for us. Thank you very much once again. Dr. Samuel Kojo Amoakohene is an anesthesiologist, a COVID-19 ICU team leader at ACHN Health Network Connecticut, a co-founder and president of Global Partnerships Paludyne LLC. This is still The Pulse with me, Gifty and Apia. Let's go for a very quick break. We'll be right back. When we come back, we'll talk about how children are feeling so hopeless that they feel like getting out of this country is the best option. Not just that, some of them are actually contemplating suicide. That should worry you. We'll talk about that when we return. Do stay with us.